Welcome back, everyone. We saw a brief package on fees. Now I'd like to introduce you all to our speakers. We have Dr. John Ashford with us, Michelle Skelly, and Matthew Ward. So how are you all?
Good.
Thank you.
Good.
How's Pakistan treating you?
Good. Very good.
Very good?
Very good. We're gaining weight by being here, but it's really good.
Guess that's pretty much about Pakistan. You eat.
Yeah. Yeah.
Eat? Okay. Can you brief me a little about what fees is?
Actually, a medical a test. It is one in which we use a scope and we look into the throat while a person is swallowing, and we determine whether or not they are getting any food into their lungs, which could make them sick, and whether or not the food can get to their stomach okay.
So, Matthew, what kind of patients do you think can come for a fiber optic endoscopic evaluation of swallow?
Really, it's good for any type of patient. The equipment tends to be quite portable, so it is very beneficial for patients who are unable to move from their bed or who are critically ill, and as opposed to having to take that patient down to radiology, whom they may not be able to make the trip because they're too sick, you can take the equipment right to their bedside. So just about any patient, but it's specifically helpful for patients who really can't be moved because they're so critically ill.
Who would refer a patient for fees to a speech-language therapist?
Any physician. So you have ENTs, primary physicians, general practitioners, gastro or pulmonologists. So any physician can request a speech pathologist to complete a fees assessment.
How can a person benefit from fees?
So what FEES allows us to do is, if we suspect someone has difficulty swallowing, we can't see much from the outside. So you either have to use X-ray technology or you have to use some sort of fiber optic technology, which is the technology used in FEES. It allows us to see inside the throat, to see if they do have just difficulty swallowing, and if they do, what we can do to help them get better.
Interesting. So how important is it to get a fees for swallowing disorder patients, John?
Well, it's really important if a person feels like, or if a family member feels like someone's having trouble swallowing, coughing, choking on their foods, they may be maybe not eating as much. It's very important that they see a physician about this, and that physician then refer for the swallow study so that we can find out the causes, because a person can become dehydrated, people can lose weight, they can get sick. Actually, they can develop pneumonia if they have a really severe type of swallowing problem.
Okay, so we will carry our conversation and we'll be right after a break.